Hello, my name is Fos Mohammed, and this is my younger sister Binti. We are from Somalia, which he presented with childhood problem of hip issues, which is difficult of walking and mobility. And she had 2 surgeries back in Somalia, which is unsuccessful. We came to Hyderabad to Apollo Hospital, and we consulted Dr. Sharat Kumar, which she was diagnosed with hip problem, and surgery is done by Dr. Sharat Kumar, which is successful. After 1 month, she is able to walk and do everything in daily activities. Yes, we had Dr. Sharat Kumar from a family member back in Somalia, and which we came to treat my young sister. And now we have a successful surgery, and I also recommend anyone back home in Somalia to consult with Dr. Sharat Kumar. And thank you, Dr. Sharat Kumar, and also Apollo Hospital.
Hi, I am Dr. Sharat, joint replacement and sports surgeon here. Today we have Binti. She's an 18-year-old young lady from Somalia. She presented with hip pain and difficult and abnormal gait from childhood. She was operated in Somalia twice without much success. So when she came here, we investigated. We have done the X-rays, which showed what a condition called as DDH, Developmental Dysplasia of Hip, also called as congenital hip dislocation, and it is a challenging case. The X-ray showed significant dysplasia of the acetabulum as well as distortion of the femoral head. So for these kind of challenging cases, we often go for 3D model printing, which helps in planning for surgery, particularly when it comes to, you see, this is her 3D model of the deformed hip. So when you look at it, you can understand the degree of the distortion. So this is the femur. Now instead of being round, it has lost it is deformed. The same thing, the acetabulum, it is not in the normal position. It has gone much more proximal. Instead of being cup-like shaped, you can see that there is deficiency of the walls of the acetabulum. So in these cases, to have this kind of picture helps us to plan surgery, particularly when we are operating. It helps us to size the acetabular cup, and also when we have to ream, we know how big the walls are. Accordingly, we can ream. Otherwise, we can damage, and then it can lead to instability. So this kind of technology helps us a lot. I feel in difficult cases, it's better to do a 3D printing so that we'll have a better function. In challenging cases, particularly like DDH, it is helpful to have 3D printing models so that we can plan surgery properly and so that the final outcome will be successful. Because these cases, patients can have problems with loosening, dislocations, as well as limb length discrepancy. So in these cases, it's always helpful. Thank you.